The patient is critically unwell. They're being ventilated, as you can see. They're stable, but certainly without this ventilation, they will be in a very serious situation.
Inside this intensive care unit in Melbourne's west, this patient is fighting a losing battle against coronavirus.
The second wave is more concerning than the first wave because there is a lot more community spread of COVID-19.
Today, ICU physician Dr Forbes McGain is working a 12-hour shift.
It is certainly an extra stress and strain for the intensive care unit staff. I think there's simply more people infected with COVID-19, and as a result of that, there are more people coming into intensive care.
I think there's still a fair bit of apprehension because we definitely, I don't think, have reached the peak.
There are currently 31 COVID-19 patients in intensive care across Victoria.
Our intensive care unit is filling up fast. It's quite distressing, actually. We lost a patient the other day that we palliated. It's really distressing to see patients dying because of this.
Others are clinging to life. Vishwanathan Nair has been here for 2 weeks. His family gave us permission to show his face.
He has been a fighter all throughout his life.
His son Abby has also tested positive. He's at home, isolating with his family.
I cannot imagine my mom having a life without him. I cannot imagine a life wherein I don't have dad around. I've had the thought a couple of times, but I have sort of tried to skip over it. It's going to be heartbreaking.
Even if they're considered at risk of death, patients can't have family members by their side. Nurses sit with them instead.
It's kind of sad, but we have to stay positive and think that he'll be good and he'll be back home quickly.
Keeping hospital workers healthy is a challenge too.
You could imagine in an environment like this, if one staff becomes positive, you end up having to move out many staff workers for 14 days. It's a really big problem.
But unlike during the first wave, frontline staff here are on the front foot. A clinical trial for this portable plastic cover, designed and built in the months coronavirus cases dropped, is now being rolled out.
You know, you can still easily care for your patient under this, but you've just got that extra barrier.
It's a personal ventilation hood developed by researchers at the hospital and the University of Melbourne. It covers a patient to trap in infectious particles, then filters the air so it's safer for healthcare workers to breathe.
It gives us a lot of peace of mind, I find, so we're able to do the procedures that we would normally do on the average intubated patient without the fear of aerosolising the coronavirus, basically, which was a huge stress on the staff here.
A device like this is really important when you have, notice, an open planned ICU. It's designed to provide safe care and care that will allow non-invasive ventilation to occur, as well as inhalation therapies that are more difficult when you have COVID-19.
These are prototypes, but if approved by the Therapeutic Goods Administration, they could be used in COVID-19 wards around the world, helping to keep more healthcare workers on the front line.
The intensive care community never assumed that this was over. I think we're just at the early phase of the ICU build-up, and how long it will last at the moment is extraordinarily difficult to be sure of.
Dr Stephen Warrilow is the Director of Intensive Care at Austin Health.
This is an area where we store a lot of our equipment. We have the dialysis machines, mechanical ventilators and ultrasound machines and infusion pumps. I think we're all concerned. So in business as usual, we would manage, say, 23 patients, but we can double that very, very rapidly, and we can manage up to 100 with a little more time to organise ourselves.
Victoria now has about 700 ICU beds, up from about 400 pre-pandemic. But hospitals now have more than just medical equipment in their arsenal. They also have clinical trials for possible treatments.
We had all these trials set up, and then the effectiveness of the first lockdown meant that we were unable to recruit any patients.
The second wave has changed that.
Look, I'm really sorry to hear about your positive COVID result, but you've certainly come to the right place. I am running a trial looking at whether zinc...
Dr Joseph Ischia is a urologist in the Department of Surgery at the University of Melbourne. His trial here at Austin Health has been fast-tracked.
Look, I'd love to see that zinc is able to improve the oxygenation levels. We want to see is, do people require less oxygen when they're in hospital with severe COVID-19 infection? Are they able to either not go into ICU if they start on the ward, or are they able to get out of ICU more quickly?
The zinc is added to an intravenous drip and given to this patient daily. She's the first to be enrolled in the trial.
How's she going? Is she staying stable or is she getting worse?
She was quite unstable over the weekend, but she's slowly getting there, and we'll try over the next few days to wake her up and see how she goes.
We always want to do better for the next generation than we did for the last. Now, these generations in COVID-19 have been compressed really close together. What we're looking to do is, can we improve the outcomes of people in 3 to 6 months' time by doing studies now?
The latest government data shows Australians with coronavirus who end up in ICU have an 85% chance of surviving. In Britain, that number is 60%, and just 30% in the United States.
I think there's hope that things will turn around in the next couple of weeks and we will get on top of this second wave.
At St Vincent's Hospital, Dr Barry Dixon is studying blood-thinning medication heparin. COVID patients on ventilators here are inhaling the drug as a gas.
We did a study of inhaled heparin before COVID in patients with lung injury, with pneumonia, similar to the COVID patients. And that study found that giving people inhaled heparin accelerated their recovery. But the thing about heparin is it also binds with COVID, and so we think it inactivates COVID as well.
In recent months, a swathe of other clinical trials have been approved for COVID patients in Australia. Therapies the first wave of patients didn't have.
I expect our patients now will be doing better than a few months ago when we didn't know that those therapies worked.
It's been another long day in ICU here at Footscray Hospital.
I would like to say they're doing a really, really good job trying to keep him healthy and happy, and I would like to thank them on all the hard work that they've been doing for us.
I think the nurses are finding this particularly hard. I feel for them because they're the most exposed to the patients and trying to do all the good care that they can, but knowing that they're at higher risk.
Do you find that
and then you go home and you just hope that, the family doesn't get COVID from you.
This pandemic, I think, is taking a toll on everybody. It touches absolutely everybody from all walks of life.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.